According to the Ghana Health Service, recent data on COVID-19 in the Ashanti region shows that there has been a spike in cases. The Ghana Health Service also says another worrying trend is that the cases being recorded are symptomatic, unlike previous ones. Dr. Michael Roxine Jane is the Ashanti Regional Director of Health Services in charge of public health.
From May, we started seeing an increase in the number of cases. I said that we're doing an average of 20 per week. And from May, somewhere the second week of May to third week, we observed that gradually the cases were building up bit by bit. And in the last 3 weeks, we've recorded an average of about 200 cases per week. And the pattern is a step ladder. Every week, there's a build on. So if you had 200 this week, last week, or the previous week, the next week goes a bit higher above 200, and then it's been that pattern. So I mean, it's not something that is um, heartwarming at all. I mean, it's very, very worrying looking at the way things are going. At the inception of the outbreak, majority of the cases, or a certain proportion of cases, were asymptomatic in that they have the infection, but they were not sick. So they could even go home and isolate, and they didn't need care at the hospital. But now, most of the cases we are having are symptomatic, albeit mild, that they have symptoms, but some are mild. But looking at what's happened in India, and with this strain having entered Ghana, and the general neglect of the protocols that we are seeing, we risk being overrun by this strain. No matter the load of logistics you have, no matter the number of beds you have, this virus, if we do not take care to prevent exposure, then you risk having your entire world flood. Assuming we even have over 2,000 beds for COVID in the Ashanti region here.
He's also urging persons who have been vaccinated to continue observing the protocols, as failure to do so could put others at risk since they can get infected and spread the virus.
If you've taken the vaccine, all well and good, but it doesn't mean you can remove your mask, because I mean now, for now, or as at this situation, if you have taken the vaccine, it protects only you and you alone, because the vaccine will prevent disease in you. It doesn't mean you won't, if you get exposed, you won't get infected. If you've taken the vaccine and go close to someone with infection, and you've not protected yourself by keeping the distance or wearing your mask or observing all the hygiene routines, then you risk having the virus jump on you. And once you have the infection, yes, you may not fall ill, but you also have the chance of transmitting that infection to somebody. Mind you, children did not vaccinate. Those persons below 18 years, those who were pregnant, and the majority of society have not vaccinated because the vaccine is not available. So if you have taken the vaccine and you feel that I can go about my business as usual, I won't wear a mask, then you are a threat to society.
Meanwhile, Citi News checks in parts of Kumasi show that many people are still not adhering to the protocols despite the increasing numbers in recent times.